Imagine for a second that you walk into a clinic and your diagnosis comes not just from a doctor, but from an AI that's seen literally millions of cases just like yours. Now, this isn't some far-off sci-fi dream. It is happening right now. It's the cutting edge of medicine, and AI is getting ready to totally change how we find and fight disease. So let's dive into this incredible new world. But this whole revolution brings up a really, really important question, one that gets right to the heart of it all. Would you, personally, be okay trusting an algorithm with something as important as your health? I mean, if you just look at the numbers, the case for AI is just ridiculously strong. The thing is, in a controlled environment, these systems aren't just faster. A lot of the time, they're actually more accurate than the human experts. We're talking truly top-tier performance. And look, this isn't just some vague idea. We have the data. In super important fields like dermatology, ophthalmology, and pathology, these AI models are hitting accuracy rates in the high 90s. That's almost superhuman. It's the ability to spot things like diabetic retinopathy from a simple eye scan, or find tiny cancerous cells in a tissue sample, better than we ever could before. So, with that kind of performance, you'd think patients would be breaking down the doors to get an AI-assisted diagnosis, right? I mean, it seems like a total no-brainer. But is that what's really going on? Nope, not even close. In fact, when researchers looked into it, they found this wild paradox. People are way less likely to go see a doctor if they find out that doctor uses AI. And what's really interesting is this has nothing to do with politics. Democrats, independents, Republicans, they all feel the same way. And it goes way deeper than just politics. This feeling cuts across pretty much every demographic you can think of. It doesn't matter if you're young or old, a man or a woman, what your education level is, the hesitation is there. We're looking at a huge, widespread trust gap. So that's the big mystery, isn't it? If the technology is so powerful, why are we all so hesitant to actually use it? What's really behind this deep-seated distrust? Well, the answer is kinda weird, and it reveals a really strange split. So on the one hand, the more someone actually uses AI in their everyday life, like on their phone or whatever, that trust gap starts to get smaller. Familiarity makes it less scary. But, and this is the crazy part, the more someone thinks they know about AI, the wider the trust gap gets. It's like the more you understand the potential problems, the more skeptical you become. And here's the thing, that skepticism isn't just people being paranoid or not understanding the tech. There are very real, well-documented issues with these systems that absolutely justify why people are so concerned. One of the biggest problems has this kind of scary name, data pathology, but it's actually a simple and pretty dangerous idea. If the data you use to train an AI is biased, well, then the AI is going to be biased too. And that leads to it making consistent, systematic errors for entire groups of people. And listen, this isn't just a what-if scenario. This is happening right now. For example, AI-powered pulse oximeters, the little things they clip on your finger, they just don't work as well on patients with darker skin. Models trained to spot skin cancer are less accurate for dark-skinned patients, all because the training data wasn't diverse enough. And the results are just awful. In some critical care situations, misdiagnosis rates for minority patients can be more than 30% higher. And this workflow here really shows you why it's such a tough problem. This bias isn't just some little bug you can fix. It can sneak in at every single step of the process, from the moment the data is collected to how the model is built, all the way to how it's actually used in a hospital. It is a systemic problem. But bad data is only one part of the story. The other big reason for all this distrust is the classic black box problem. A lot of these powerful AI models are so incredibly complex that even the people who built them don't fully understand how they got to a specific answer. And not being able to see the why is a massive roadblock. I mean, check out this statistic. It's pretty telling. A third of radiologists admit that they've ignored an AI's recommendation, even when it turned out to be the right call, just because they couldn't follow its logic. So, if the experts themselves can't trust it, how can we expect patients to? So, okay, where does that leave us? We're at a crossroads. We have this technology with unbelievable potential, but we have this huge trust deficit holding it back. How do we close that gap? How do we build a medical AI that's not just smart, but one that's genuinely trustworthy? All right, so what's the game plan? Well, researchers have laid out a pretty solid 4-part framework to build that trust. First, we have to fix the data. That means training AI on datasets that actually look like our diverse global population. Second, we have to demand transparency, using something called explainable AI that can basically show its work so a doctor can see the why behind a diagnosis. Third, we need clear accountability. When something goes wrong, who's responsible? The developer? The hospital? We need to know. And finally, we've got to update patient consent, making sure people are fully in the loop about how AI is being used in their care. When you boil it all down, it all comes back to this one idea. The biggest challenge for AI in medicine isn't just a technical one. It's not about writing smarter code. It is a deeply human challenge. It's about building systems that earn our confidence. The technology is here. Its potential is absolutely massive. It promises a future where healthcare is faster, more accurate, and available to everyone. The only question left is, are we ready to build the trust to make that future real?